Welcome to Mo Health Media. My name is Guy Danhoff. We want to thank you for joining us today as we kick off the 2021 series, as this is episode 1. Today, I'm joined with Sherri Homan, and Sherri's going to talk to us today about the questions that you have and I have regarding the latest updates with the COVID-19 vaccination. And Sherri, how are you today?
I'm good, thank you, Guy. Thanks for having me.
Absolutely. Sherri, as we know, which we're excited about today, we're going to talk all things COVID vaccination. And you are one of our content experts, as your background is in epidemiology. And I was wondering if you could share with us some of the news that was reported in December, as there was two big, news briefs coming out on the vaccination. And could you explain in easy terms what those are?
I think the two big updates were that we have an emergency authorization from the Federal Drug Administration for 2 vaccinations now for COVID. We've got Pfizer and Moderna. And so that is just wonderful that those have been approved and have been shipped now and are being actually administered.
With that being said, is this for everyone, or what's the latest that we know on who should take it, who maybe shouldn't take it, where we are, in terms of, as far as that goes?
Sure. Both vaccinations are for at least 16 years of age or 18 years of age. One is 16, one is 18. So we don't have a vaccination yet for children. Pregnant women, they are being encouraged to discuss with their primary care physician or their OBGYN whether or not they should take it. The risks have to be weighed against the benefits. So that's got to be on a one-on-one personal decision for pregnant women. And also people that have underlying medical conditions that have had severe allergic reactions before, they also need to talk with their providers, because right now there have been some allergic reactions. So if you have that history, you really need to talk with your physician.
And Sherri, with it, I think one of the other questions is, how does someone go about getting the vaccination?
Right now, it's laid out in a plan of who are the ones that need it first. And first in line are our healthcare professionals, our providers that are on, in the hospitals that are providing that patient care, ICU nurses, emergency physicians. All of those people are first, as well as those in convalescent homes or the nursing homes. Elderly, those are the ones that need the vaccination first. Second, it'll be going out for teachers and other essential workers and that kind of staff. And those with underlying conditions that are at higher risk, like, COPD or something like that, heart disease, diabetes, those things.
Absolutely. And Sherri, where can people get more information, the latest information? I know that you're a big fan of CDC,
Yes.
of course, but where else can people go that want to learn more on the latest so that they can get as much information and be as informed as possible regarding the vaccinations?
Well, the Centers for Disease Control and Prevention is one excellent source. You can also go to the Missouri Department of Health's website. There's a new other website called, I think it's called Show Me Strong. You can get information there on the numbers, as well as COVID vaccines is another website. So there are websites out there that will give you information.
Excellent. And just so our viewers know, we're going to actually post those websites, those web addresses, right here in the description on YouTube. And Sherri, as we wrap up, I know you're going to have an upcoming webinar. Could you maybe tell our viewers what that's about and why they should attend?
Sure. The webinar is going to be focused on understanding some of the numbers. Why do we use rates instead of just case numbers? And that's because you can compare rates because they take into account the population size. So you may have 10 cases in this community and 10 cases in that community, but depending on their population sizes, tells you the real story of how comparable and what's really going on with the disease in that community. And so we're going to talk about some of the numbers. I know people hear about positivity rates, you know, and some people think that that means everyone in that community, say 20% of the community is testing positive. That's not exactly what that means. That means out of all the people that have had a test, that's the number that have tested positive. So I want to make sure that people understand what the numbers mean. So we're going to do that. We're going to talk about the vaccinations. We're going to talk about other things related to COVID, particularly universal measures to prevent COVID. You know, everybody's, I know, really a little fatigued with the mask and the, you know, all the other things, the social distancing that we need to do, hand washing, but they are universal precaution measures that we still are going to need to use for a while.
Absolutely. And I'm very excited to attend that myself, because I know that you're going to, you know, in some cases do a little deeper dive than maybe the way the news reports it to us. So I'm really excited with your background in epidemiology to really break down and make it easy for us to understand what is really going on with COVID-19, State of the Union, as well as what is the latest going on with the vaccinations. And Sherry, I just want to thank you so much, you know, for taking the time today for this broadcast. And to our viewers, if you want to learn more about Sherry, you can also just check in the description. We'll have her full bio there. We'll also have these resources there for you. And Sherry, look forward next time when you do your live webinar, and we'll be putting out that registration soon, and we'll be releasing the date of when that's going to be. And I just want to thank you again for the time and the information that you shared today.
Thank you.
For Sherri Homan, I am Guy Danhoff. We want to thank you for watching episode 1 right here on Mo Health Media.